Subtalar implant procedure for valgus flatfoot correction, 3D animation Dworska Hospital. Inserting a subtalar implant into the sinus tarsi is the minimally invasive procedure used to treat flexible valgus flatfoot. This animation briefly presents flatfoot deformity development and an exemplary course of the subtalar implant procedure. When looking at valgus flatfoot from behind, the heel appears to be turned inward and the medial malleus seems to be more prominent. A common symptom of flatfoot is the too many toes sign. The little toe or possibly more of the lesser toes can be seen laterally from the heel. Valgus flatfoot is characterized by the calcaneus excessively tilting inward, resulting in the talus slipping towards the inner side. It's called patellar subluxation. Looking at the foot from the medial side, in most cases the longitudinal arch is collapsed. Flatfoot development, deformity progression. We can see an excessive increase in heel eversion. It's accompanied by gradual plantar flexion and adduction of the talus. This abnormal position between the talus and the calcaneus has a negative impact on the talonavicular articulation. The arch collapses. The forefoot goes into the dorsiflexion in an abducted position. The combination of increased hindfoot valgus, dorsiflexion and forefoot abduction is termed overpronation of the foot. What are the indications for subtalar implant procedure? The procedure is performed in the case of pain in the flexible valgus flatfoot, when the deformation has not yet become fixed. It means when the foot regains its correct shape during non-weight bearing. Hindfoot realignment must be possible. Simplified animation of the subtalar implant procedure, arthroereisis. It's a minimally invasive method requiring a small skin incision up to 1.5 cm on the anterolateral side of the foot. The incision provides access to the sinus tarsi, the cylindrical canal between the talus and calcaneus. The orthopaedist may increase the space of the sinus tarsi by manually reducing the deformity. Our orthopedic surgeons release the interosseous ligament to allow the implant to be properly placed in the sinus tarsi. The role of the implant is to limit the excessive movement between the talus and the calcaneus while maintaining mobility in the subtalar joint. The appropriate profile of the implant enables optimal fitting into the sinus tarsi. Our orthopedists use only proven models of the implants. Before placing the implant, it's necessary to select its appropriate size using the set of dedicated trial sizers. First, a directional wire is inserted through the entire length of the sinus tarsi. Then, a trial sizer is inserted into the sinus tarsi. It allows the surgeon to assess the degree of the obtained hindfoot correction. If there is still excessive calcaneus eversion, the trial sizer's diameter is increased. Ultimately, we strive to obtain physiological 5 degrees of hindfoot valgus when the foot is weight-bearing. The surgeon must take this into account when performing the procedure under unloading conditions. In the next step, the subtalar implant of the appropriate size is placed on the tip of the compatible screwdriver and then inserted along the guide wire precisely into the sinus tarsi. The position of the implant is controlled with fluoroscopy. Then the screwdriver and guide wire are removed from the foot. Thanks to this, hindfoot correction is achieved without the need to cut the bone. We present the range of foot pronation under loading conditions before and after the subtalar implant surgery. In the general view of the foot, we can also see a reduction in foot overpronation. What are the main benefits? This is minimally invasive procedure without cutting bone. There is less risk of infection and no complications related to osteotomy. The benefit is lower post-operative pain. It speeds up recovery. We can also maintain mobility in the subtalar joint and preserve natural shock absorption of the foot. In the photo, we present a real example of the foot before and after the subtalar implant procedure performed at our hospital.